Dr. Eric Balkavich, and we're back for another edition of Thyroid Thursday. Today I want to continue the discussion of thyroid hormone transport. Last week I talked about the transport of thyroid hormones into the cells of the body is really what determines whether you have hypothyroid symptoms or not. It's not about how much T4 or T3 the gland makes. It's not about how much T4 or T3 is in the bloodstream. It's not really a matter of what your TSH level is, T4 or T3 on bloodstream. It really matters how much T4 and T3 get into the peripheral cells of the body and how much T3 binds to that receptor. So today I want to continue that discussion and talk about thyroid hormone transport, okay? And so what we do know now is that T4 and T3 require energy or active transport to get into the peripheral cells of the body. So without active transport or energy, T4 and T3 can't get into the peripheral cells of the body. If you can't get the T4 and T3 out of the bloodstream and into the peripheral cells of the body, then it can't be converted. T4 can't be converted into T3, and T3 can't bind to the thyroid hormone receptor, and therefore you will have hypothyroid symptoms, even though T4 and T3 are normal. So what are things that may impact the thyroid hormone transporters in your peripheral cells? And these are the cells away from the pituitary gland. And so things like high cortisol and inflammation, dieting and obesity, insulin resistance, infection, and stress all reduce thyroid hormone transport into the peripheral cells. So if you have these things going on and you have hypothyroid symptoms, it's not about the gland. It's not about how much is in the bloodstream. These are the things that are blocking or inhibiting T4 and T3 from getting into the peripheral cells. And if it can't get into the cells and T4 can't be converted into T3, or T3 can't get into the cell and go right to that receptor, you will have hypothyroid symptoms, no doubt about it. So what about your TSH? Your doctor says the TSH level is normal. Well, it's because TSH, thyroid stimulating hormone, represents the pituitary gland and the pituitary cells' saturation of T3. And so there is an assumption, a couple assumptions that doctors are still working under. One is that high levels of T4 will just diffuse from the bloodstream right into the cells. It's the same as with T3, and that it didn't require energy. Well, that's somewhat true. It is believed that it does not require much energy, if any, to get T4 and T3 transport into the pituitary cells. We do know that it is required for most of the peripheral cells of the body. So the pituitary gland acts differently than the peripheral cells of the body. When T3 gets into the pituitary gland, or T4 gets into the pituitary gland and gets converted into T3, which is primarily what happens, then T3 can bind to the thyroid receptors in the pituitary cells, and when the pituitary cells become saturated with T3, then the body says, hey, tells the gland itself that, hey, we don't need any more thyroid stimulating hormone, so TSH levels will go down. And if TSH levels go down, then there's decreased production of T4 and T3. Because it's so easy to get T4 and T3 transported into the pituitary gland can be saturated so much quicker, so much faster. And as soon as T4 and T3 production goes down, then there's less T4 and T3 to get into the peripheral cells and saturate those. So we can then have two problems. T4 production and T3 production goes down, and we've got things that are blocking these transport proteins. So when you go to your doctor and you have hypothyroid symptoms, but all he does is a TSH value and assumes that because the pituitary gland is saturated with T3, that the rest of the peripheral cells of the body are saturated with T3, and that your symptoms must be caused by something else, he's working under inappropriate assumptions. Today's science says that the pituitary gland's transport molecules work and behave differently than the transport molecules in the peripheral cells of the body, okay? So you can definitely have hypothyroid symptoms with normal or even low TSH levels because the pituitary gland is saturated, but the peripheral cells of the body are not. So what do you do? Well, you've got to address your stress load. You've got to reduce your stress because stress triggers something I talked about before, which is called the cell danger response. And when stress triggers the cell danger response, you will get decreased transport of thyroid hormone into the cells. It's a protective mechanism. The cell assumes under a danger response that it's under attack, that there's a bacteria or virus or something within the cell that's stealing energy. So it makes the cell sick. And one of the things it does not want to do is increase the metabolism of a sick cell. So thyroid hormone transport is reduced, and therefore there's going to be decreased transport of T3 and T4 into the cell, and you're going to have hypothyroid symptoms. So what do? Look at your emotional stress. If you have a lot of emotional stress, you need to deal with that because the cell doesn't understand the difference between the different types of stress. It just reacts to stress. And any form of stress becomes something that can trigger the cell danger response. And anything that triggers the cell danger response is going to reduce thyroid hormone transport into peripheral cells, but not have the same impact at the pituitary gland. So check out your emotional stress. Are you emotionally stressed out? If you do, work with somebody to address those things. Are you under physical stress? You could have little activity, and that could be a problem. You could have excessive exercise and activity, and I see that quite often. People have hypothyroid symptoms. They go to their doctor says TSH levels are normal, and yet they're obese, they're overweight, and the doctor says, listen, you just need to exercise harder, work out harder. And people exhaust themselves or over-exercise, which creates stress on the body and on the tissues, which can impact the transport mechanism. So evaluate your physical stressors. Dietary stress. What you eat makes a huge impact on driving inflammation in the body. Look at infectious processes. You can look for organisms, bacteria, viruses, parasites, and fungus. All these microbes in the body can create stress, trigger the cell danger response, and decrease thyroid hormone transport into the peripheral cells, but not impact the pituitary cells, and therefore TSH could still be normal. You've got to look at environmental stress. What are the toxins in your home, in your commute, at work? You want to look at respiratory stress. Many people just breathe improperly. They're big-time mouth breathers. They snore at night potentially. They do a lot of their breathing through their mouth instead of through their nose. That can create a stress response in the body. And lastly, look at your habits. Are your habits the things you do every day, are they creating more stress in your life? You may say, but these are the things I need to do. They may not be. They just may be bad habits. Look to clean up those habits. So if your doctor tells you your TSH level is normal, but you still have hypothyroid symptoms, realize that the stress in your life is impacting thyroid hormone transport. It's good for somebody to evaluate cortisol and inflammation and what you're doing from a diet standpoint, especially if you have a calorie restriction. If you're obese, obesity has been associated with the cell danger response and decreased transport. Insulin resistance. So these are the things that must be looked at and addressed if you want to increase thyroid hormone transport into your peripheral cells. Again, you could flood the bloodstream with T4 and T3 hormones, but if they can't get into the cell, you will still have hypothyroid symptoms. So address your life stressors. Hopefully this helped. I look forward to giving you some more information on next week's Thyroid Thursday. Take care.